Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to go over 3 simple techniques you can use to relax either during physical therapy or when doing your exercises on your own to hopefully increase your knee bending or straightening range of motion with your exercises. Before I jump into that, be sure to hit that subscribe button if you're interested in all things related to knee replacement surgery, exercises, frequently asked questions, and much more. So the first one I'm going to talk about is actually a maneuver or a technique that's used for doctors often when you're trying to get the reflexes. So your knee jerk reflex, so taking that little hammer, tapping it on your knee. Sometimes we're so focused and paying attention to that the reflex tends to be inhibited, so it doesn't happen when you hit the hammer on the knee. So this is called the Gendrastic Maneuver, so I'm borrowing it from what they use to help elicit reflexes in your knee as a technique to help relax and decrease your focus and attention when you're doing your range of motion exercises. So all you want to do for this exercise is you take your arms and you're going to hold them up like this with your hands in front of you at chest level. You're going to interlock your hands and fingers and you're just going to try to pull apart, and you're going to pull your fingers apart, and at the same time you're going to kind of clench your teeth and bear down with your teeth. So it looks something like that. And you're just going to do that, and then at the same time, you can do that laying down, you can do that seated, standing, and at the same time, you're going to do your range of motion exercises, your bending exercises, your straightening exercises, either with the help of a physical therapist or someone you're working with, or doing them by yourself. And what you'll notice is by doing this technique at the same time, it's going to consciously, a lot of your attention is going to be on this technique. So you're going to be paying less attention to the stiffness and achiness and discomfort with doing the exercises. And also at a subconscious level, it's going to decrease some of that downward inhibition coming from your nervous system. And that's going to help relax the knee as well to hopefully get better range of motion, be a little more relaxed, get better bending, better straightening with your exercises. So what's another way you can do this? Well, you can do that with cognitive tasks or mental tasks, and I always like to incorporate, when you're doing that task, a verbal component. So for example, some of the simple ideas are, pick a number, so say 70, and you're going to count backward by 3s. So you're laying there, you're sitting there, and you're doing your exercises, or the physical therapist is doing the range of motion exercises, and you're counting backwards by 3, starting at 70. So you're going 67, 64, 61, 58, and just all the way down. And again, this is a way to distract your attention. You're focusing on this mental task while the range of motion exercises are being performed, and you're going to have a little more relaxation in the knee and the leg. You can do any type of verbal or mental, problem-solving thing. Maybe it's say, name as many presidents as you can. Maybe it's name all the 50 states. Whatever it may be, you can be creative with it. Another way to do it is just talking and answering questions. So if you're working with your physical therapist or working with a family member and they're doing some of the range of motion with you, just say, okay, well, what did you do today? Where are you from? Where did you go to school? Just talking and distracting away from the attention on the knee, but still doing those range of motion exercises at the same time. And then the third thing I think would be, something we don't hear often is using your phone during therapy or during your exercises. And you think, well, you always hear, we don't want you on your phone, we want you to be focused and paying attention to the therapy. But actually, using the phone can be a good distraction. And what I think about is playing a game on your phone. So something simple, maybe it's the Wordle, you're doing the day's Wordle, you're playing Tetris, some kind of game that's taking your mental attention, and again, at the same time, you're playing that game, and maybe you're by yourself doing your, in a chair or laying down doing your bending exercises, or maybe your physical therapist is doing the bending exercises. And again, it's just distracting your attention away from, the discomfort, the pain, and the stiffness. It's interesting that there's actually some research coming out that they're using virtual reality as a way to provide pain relief when people are undergoing different procedures, medical procedures that can be painful and uncomfortable, they actually had the person doing virtual reality. Again, same principles, kind of a distraction of conscious and unconscious level, or subconscious level, I guess, away from the pain of what you're doing. So easy way to do that without buying a whole virtual reality headset and everything is just playing a game, playing some Tetris, doing something on your phone as they're doing the exercises. Now obviously when you need to pay attention to your therapist and things like that, very important to put that phone away, but this is one time where using the phone might be beneficial during your therapy sessions. So I hope you found this insightful and helpful. Please leave your comments, your questions, your suggestions all below. Please be sure to hit that like button if you found this video helpful and insightful, as that helps spread it to other viewers who may benefit. Thank you for watching.